Welcome to WellMed, the first step in starting your circle of care. At WellMed, our goal is to surround patients with a level of health care they need and deserve. We would like to take a few minutes to introduce you to WellMed's Circle of Care and how our doctors have created a healthcare program that caters to you, our patient. A program that puts your needs first. WellMed's mission statement provides the proper insight to what we stand for and how we have positioned ourselves to help the senior community. Our name, WellMed, is a daily reminder of our objectives as a medical group. Our goals are to help the sick become well and to help patients understand and control their health in a lifelong effort at wellness. WellMed's Circle of Care has taken our values of quality medical care, quality service, emphasizing healthy lifestyles and teamwork to the next level. Ask yourself these questions. Have you ever found yourself needing a ride to a doctor's appointment but could not find anyone to take you? Have you ever been prescribed a drug that you could not afford? Have you had tests performed only to find out they were the same tests you already had done and no one shared the results with your doctor? Have you ever been seen in the hospital by a physician you did not know? Have you ever been discharged from the hospital without knowing what to do next? Listen to our short story to find out how WellMed has taken steps to make you feel more comfortable with your medical decisions. Please allow me to introduce Dr. George Rapier III, CEO of WellMed Medical Management. He will share WellMed's Circle of Care program and how we can help you live a healthier and more fulfilling lifestyle. Ladies and gentlemen, Dr. George Rapier.
Hello and welcome. I am Dr. George Rapier, the CEO and founder of WellMed. At WellMed, your well-being is our central focus. Relationships are important, especially with those responsible for your health care. We understand that our seniors face many challenges in receiving proper health care, and that is why the physicians at WellMed developed the Circle of Care. The Circle of Care consists of a personal health care team committed to treating you, our senior patient, with the level of care that you need and deserve. Starting with your primary care physician, or PCP, and their medical team, WellMed Circle of Care is a program that puts your health care at the center. One definition of a circle is a group of people sharing an interest or activity. WellMed Circle of Interest is you, the patient. WellMed defines the circle as an unending, unbroken group of caregivers that work together to give you a happier, healthier life. The Circle of Care concept is simple. Our program surrounds you with a high quality of care from the moment you first meet your doctor. Your physician coordinates your care, staying in touch with all who provide you care. Each doctor has long-term working relationships with the highest quality specialists and hospitals. Our network has primary care physicians and physician assistants. With 12 locations, chances are there's a WellMed clinic close to you. Other areas within the Circle of Care include our electronic medical record, Q Pharmacy, registered nurse case managers, disease management programs with Health Right registered nurses, special value-added services, and social service programs. You will learn more about those areas of care during our story. Our goal is to educate you on what our team does to complete the circle. At WellMed, we offer more than just general health care. We go above and beyond what you would expect from your doctor. We recognize the concerns and challenges you face in choosing medical care that's right for you. We value your health and are here to help you while providing the best personalized medical care possible. At WellMed, we care for you. Please listen closely to the story of Joe. Like all patients, his story shows how WellMed's Circle of Care surrounds and supports him. From his first doctor's appointment to his stay in the hospital, he received the care he needed and deserved and found ways to improve his quality of life. In this story, we will introduce you to the team members who make up WellMed's Circle of Care and how they can help you. We invite you, your friends, and your family into WellMed's Circle of Care today. I'll be back after the story to tell you how you can participate in our referral program. Thank you and enjoy Joe's story.
Meet Joe. He's in WellMed's Circle of Care, and here's his story. When Joe was eligible for Medicare, he had a decision to make. He talked to his family and friends and learned WellMed's clinics offered so much more than other doctor groups. From electronic medical records, case managers, disease management programs, exercise programs, and even nutritional guidance. Joe compared his options and realized his current doctor did not have the same benefits. Then, like so many others, Joe switched to WellMed and became the center of his own circle of care. Joe chose Dr. Miller of WellMed Medical Group as his primary care physician, or PCP, to coordinate all of his medical care. When Joe turned 67, it was time for his annual physical. Last year, tests from his annual physical revealed a small buildup in his arteries. Dr. Miller wasn't too worried, but he made a note in his electronic medical records, or EMR, to monitor Joe more closely. Lately, Joe hasn't been feeling well. He has been tired and unable to work in his garden. He decided it was time to see his doctor. Joe scheduled an appointment with his PCP, Dr. Miller. Prior to the appointment, Dr. Miller reviewed Joe's medical chart in the electronic medical records, or EMR for short. The EMR is a confidential computer database system designed to provide your PCP access to your medical records 24 hours a day, 7 days a week. It maintains records of any tests, referrals, and recommendations made by Dr. Miller or anyone involved in Joe's care. During the appointment, Joe explained how tired he has been lately. Dr. Miller ordered a new set of tests. Again, the results showed abnormal results. The results were recorded in Joe's EMR. Dr. Miller referred Joe to cardiac specialist Dr. Gomez to confirm his diagnosis. A specialist is a medical doctor who specializes in a specific health field. For Joe, it is a cardiac specialist or heart doctor. Joe made an appointment with Dr. Gomez. After reviewing Dr. Miller's notes, Dr. Gomez ordered a different series of tests confirming Dr. Miller's diagnosis. After discussing these findings, they decided an agreed surgery would be best. The test results and treatment recommendations were recorded in Joe's EMR. Dr. Gomez scheduled Joe's surgery, and as Joe's PCP, Dr. Miller admitted him to a recommended Medicare-approved hospital. Dr. Miller and Dr. Gomez monitored his care during his hospital stay and discussed their plans with his case manager, Debbie, a registered nurse. While in the hospital, Debbie met Joe and explained her role as case manager and what he should expect during his stay. She assisted the physicians in the hospital and made sure all of their orders are followed. After the surgery, Debbie returned to the hospital. She discussed with Joe the discharge process, the follow-up needed, and informed him of the other caregivers assigned to him during his recovery. During Joe's surgery, Dr. Gomez notices that Joe could be a possible candidate for heart disease later in life. Dr. Gomez recommended Joe enroll in the WellMed disease management program called Health Right. WellMed offers programs for patients living with diabetes, congestive heart failure, ischemic heart disease, and chronic obstructive pulmonary disease. Disease management is a referral-based program recommended to qualified patients. Registered nurses, or RNs, specialize in the various disease management programs being offered. Disease management programs offer preventative and follow-up care. Patients do not have to be admitted to a hospital in order to participate. They may be referred by their doctor. Programs may include nutritional guidelines, programs to help prevent the disease from progressing, assistance for ongoing care, Silver Sneaker Group exercise programs, and a prescription voucher program. Joe qualified and enrolled in the disease management program based on his needs. As a part of his recovery, Joe's doctor prescribed the drug, which had a co-payment that he could not afford. As a participant in the disease management program, Joe can get his prescription filled through Q Pharmacy and have his co-payment waived by WellMed. Only participating patients can have their prescription co-payments waived if filled through a Q Pharmacy. In addition to the support Joe has received as a patient of WellMed, he may also receive many valued-added services. Remember, WellMed offers more than just medical care. Although Joe has family and friends nearby, they were unavailable to take him to a follow-up doctor's appointment. As a qualifying patient, Joe called Comfort Care Transportation. Comfort Care Transportation is a free, non-emergency transportation service for qualified patients needing a ride to and from doctor's appointments, hospitals, and/or skilled nursing facilities. As a part of Joe's recovery, his Health Right nurse recommended a Silver Sneakers group exercise program. Silver Sneakers is designed to help increase strength and flexibility for seniors. As a valued patient of WellMed, Joe also received dental, vision, and hearing benefits. He will receive annual teeth cleanings, exams, and discounts on any dental restorative work. Joe will also receive one comprehensive eye exam every 12 months and a vision allowance of up to $300 every 24 months towards the purchase of glasses and frames through contracted providers. Additionally, Joe will receive a discount on custom hearing aids every 3 years. After working hard to improve his health, Joe successfully recovered from his surgery without complications. Joe joined a Silver Sneakers exercise program to start building up his strength and energy. Soon he returned to his gardening. During Joe's follow-up appointment with his PCP, the receptionist referred him to the WellMed Social Services Unit. Team members assisted Joe to determine if he is eligible for Medicare Part D premium subsidy or other savings programs. Lisa, a social services team member, reviewed the application process with Joe, helped him fill out the forms, and submitted it to the state to see if he could qualify for assistance. Today, Joe is living a happier and healthier lifestyle. He took the advice of Joan, his Health Right nurse, and changed his diet and nutrition. He's exercising by walking every night to keep his heart strong and attending his Silver Sneakers classes. He continues his regular checkups and annual physicals to ensure he maintains his health and peace of mind. Can you relate to Joe? Do you have family and friends that can benefit from being a part of this circle of care? Thank you for listening. At WellMed, we will work to help you live a healthier and happier life. We care about your health. At WellMed, we listen and we care for you.
Welcome back. Please share WellMed's Circle of Care story with your family and friends. WellMed's mission is simple: to allow our seniors to have better health and to experience the full gift of life. Please ask your doctor or a WellMed staff member for more information on WellMed's Circle of Care. Thank you.